Hello, I'm Farrell Conant, one of the physicians at Smith County Family Practice, Smith County Memorial Hospital. Laura Hagman, our Director of Public Health, with me. We wanted to just spend a little time to update the community about our recent meetings as a medical staff and as the health department. As many folks are aware, we are seeing a greater number of cases of COVID in our county. Early on, we had very limited numbers, and we were thankful for that, but we are now seeing it more frequently. And it also means that we are seeing evidence that instead of us being able to track each case from a certain point, from a point of contact with an ill person, we're really not able to see that clearly. And so that's what is the definition of community spread, when we have cases that we really can't find out, and the patient can't say, I knew I was around someone that was sick with COVID. So we're at that point, and that's the way it is across many, many counties in Kansas and across our nation. So for us, that means we've had to rethink our process of recommendations to the community and trying to limit the spread of the disease, knowing it is contagious. And so one of the changes that as a medical staff, and again in concert with Laura at the health department, we've decided we will make a new recommendation to the community. Now, quarantine is kind of a scary word for many of us as we're learning more what that means. Now, for the patient that has symptoms and a positive test for COVID, that patient is not quarantined, they're isolated. That's a little different. That means they have the diagnosis COVID-19, and so we ask them to definitely stay home, stay isolated in one room of the home if possible, and then treat their symptoms and keep us posted if their symptoms worsen. Quarantine has to do with those individuals who are deemed to be close contacts of a person diagnosed with COVID-19. And the quarantine time is usually around 14 days. That has been a very trying thing for many families and for businesses, for the schools. And so we have decided that by advising the people in our county to be more diligent about wearing masks, we feel that can help us modify quarantine recommendations. And this means that a patient or an individual who is exposed to someone who has the diagnosis COVID-19, in other words, they're considered a close contact, if that individual and the patient with the diagnosis COVID were both wearing masks during their encounter, during their contact with one another, then the exposure, the close contact, would not require quarantine. In other words, missing work, staying home from school, whatever that might amount to. So this all hinges on more of us wearing masks more of the time. And we realize that's a hard thing too, but we've tried to find a way to make it more livable for close contacts so that they can continue to work, and families that have two people that work, mother and a father that work, they're not going to have to miss work necessarily to stay home with a contact with a family member who's been contacted with or who has COVID-19. So that's our recommendation now, and it still goes back to how do we really do our best to prevent spread. And we're seeing this unfortunately a lot in our county too. Folks are having minor symptoms that they attribute to a cold, and they think, well, it's just a cold. In years past, it probably was just a cold. In this time of our life in history, it may be a cold, and it may be just as likely that it's the early symptoms of COVID-19. So it is even more important that if you're sick, you should be at home. You should try to not expose others. And so if we do a better job of that, I think we'll see less community spread. So that's what we want to emphasize again. If you're sick, stay home. For employers, if your employees are sick, ask them to not come to work. Ask them if they're sick at work, ask them to go home. If they call in and say, I'm sick, say, okay, stay home until you're well. And all of that wrapped up in hand washing frequently, covering our coughs and sneezes, trying to avoid large mass gatherings, especially indoors, because we feel that's a higher risk for exposure and spread of the disease. So that's our recommendation, and any questions that you have, we'd like you to refer them to us or to Laura at the Health Department, and we'd like to hear from you, your comments, answer any questions that we feel we're able to. Thank you.
Thank you.